Because we're not relying on that gastrointestinal tract absorption, we can use way higher doses than what your GI tract would actually be able to absorb. My name is Alexandra Smith. I'm a naturopathic doctor here at Neurvana Health.
And I'm Dr. Morrison, and I am also a naturopath here at Neurvana.
We're going to talk to you guys about IVs, the different formulas that we offer here. To start, we'll touch on the Myers, which is just kind of a general base formula that is really rich in nutrients that we all need to get from our diet. So it's a rich formula of vitamin C, B vitamins, trace elements such as selenium, zinc, magnesium, and calcium. And it's a really good kind of general immune system support, general energy level support. So if we're feeling like a patient isn't getting enough out of their diet, or there's absorption issues in the gastrointestinal tract, that may be a really great opportunity to get an infusion like that.
Glutathione is a great add-on to something like a Myers cocktail or another nutrient IV, which is a potent antioxidant that we do make in our liver. But as we age or as we're exposed to environmental toxins, infections, that glutathione level can decrease. So we can give it in an IV to help support with any inflammation, any free radical or oxidation that we need to support.
It doesn't specifically target different hormone detoxification pathways, but it helps with that overall general detoxification so that we're more effective at hormone detox or environmental toxin overload. Heavy metals too, we'll use it.
We also offer high-dose vitamin C IV therapy, which can be useful for cancer treatment, any infection treatments, can support the immune system. Depending on the dose that we give, is a free radical scavenger, so helps with inflammation and provides an extra level of antioxidants.
NAD, short for nicotinamide adenine dinucleotide, which is the active form of vitamin B3, is heavily involved in all of our energy pathways in the mitochondria, which is where we make all of our energy, often called the powerhouse of the cell. So NAD can really help to stimulate those energy pathways. So something we'll often use when patients are experiencing low energy. Can also be really helpful for cognition, so brain function. And there's also good research on concussion and post-concussion syndrome for NAD as well.
So use NAD for infection support as well. There's some good research there, as well as addiction.
Yeah, that's a good one. I commonly use it when people are trying to quit smoking or quit vaping, and I've seen really good success with it. So chelation IV is where we use different agents that are called chelators, which bind heavy metals, kind of like a claw, and then the heavy metal fits inside. And then our bodies naturally will detoxify that through the kidneys. There's two forms of chelating agents that we might use intravenously, depending on what the overall heavy metal burden is. One is called DMPS, that primarily chelates mercury from patients. And then also something called EDTA, which chelates pretty much everything else. But most common thing we'll see on labs is lead, cadmium, or arsenic. So an IV intake is a 30-minute appointment where we walk through a patient's health history to make sure that they're a candidate for IV therapy. It's a shorter visit where we're really making sure there's no contraindication to IV and figuring out if IV therapy is an appropriate treatment option for a patient's concerns. And then based on that health history gathering, we determine what the best formula for that specific patient is.
One of the benefits of using IV therapy is we don't have to rely on absorption and bypass through the liver, getting rid of nutrients that we do want to use. So it can help provide benefits more effectively than some other oral treatments that we would give, whether that's through diet or supplementation. So people can notice more of a benefit than through food.
Because we're not relying on that gastrointestinal tract absorption, we can use way higher doses than what your GI tract would actually be able to absorb. Most patients, if they tried to absorb the amount of vitamin C, for example, that is in a Myers formula, would get severe diarrhea from a dose like that orally. So we allow for that bypass so that we can really hit those high doses necessary to see a shift in patients' overall health.
To set up an IV consultation, there's a link to our website that you can book a discovery call where you'll be booked in with the best practitioner for your health goals.